one. Welcome, everybody. This is Jason Rozin here once again with Dr. Kevin Connors. We're going to go in depth on a product that we've recently released. And I know, when I first brought some of the research to this product to Dr. Connors, I was pretty skeptical. I'm like, I don't really want to carry a nutrient or a vitamin because so many people are doing such a good job of that out there. But then when I sent you the research on this source and some of the unique features of it, with its ability to penetrate the cell, that you were really excited about it. And, then we decided to definitely move forward with this and another product you and I will talk about another time about vitamin D3. But this is a vitamin B12 product, a methylated one called MethylXyme. So Kev, tell us a little bit why, when I sent you that research, why you thought this was going to be a really good fit and kind of stand by the, keeping things unique and simple.
Well, partly it's both of those. I mean, this is unique in that it has an enzyme tied to it, so it's going to work better.
Right.
It's simple in that, okay, if you believe in enzyme therapy, then if you can combine an enzyme to anything else you're trying to do, it's going to work better. So if you're going to use a methyl product for the patient and then you have to give them an enzyme on top of it, if you can combine them into a product, it just makes it easier and the patient's going to be more apt to take the product.
Yeah, absolutely. And then, some of the more unique features about this branded form of B12 and its ability to penetrate the cell, and some of the research that's been done on it is it's pretty interesting. A lot of people will get their blood levels up on B12, but that doesn't it doesn't mean that it's getting inside the cell where it needs to go. And I know that was kind of a big thing for you, especially for the types of patients that you're usually working with, which are pretty sick people.
Well, that's the thing that everybody needs to remember, that you don't look at a person's blood B12 levels, because you look at their blood B12 levels and it'll be through the roof if they're taking any form of B12. So then the patient's immediate thought is, oh my gosh, I'm taking too much B12. Well, you got that high of a blood B12 because it's not getting into the cells. So B12 is super important. I mean, B12 is part of the methionine pathway in order for you to make methyl groups to be able to turn cells on and off. So, and B12 recycles in the methionine pathway through acetylcobalamin, hydroxycobalamin, and methylcobalamin, and it's dependent upon a couple of important genes. So if people have defects in those genes, then the need for B12 is even higher. But I'd caution you, if you're not into genetics and you're not doing any genetic testing, then you make sure you don't overdose methyl groups either. So that's why I like this product, because it's 1,000 micrograms. So you just give them one a day. You're not gonna overdose them. It's in an enzyme base. It's gonna work better for the patient. It's just easy for a patient to take and stay on.
Absolutely. Just another nice thing about what we're trying to teach people, and keeping things to that one capsule per dose serving, is just, we don't want people to overmethylate and go into that, type of healing crisis. So it's just, it's nice to be able to know you can just give them one and keep an eye on things, even if you're not doing genetics and you don't have the, the luxury of running all these lab tests. I guess just a really easy way to find out is if you give someone this product at a couple a day and they feel great for a few days, well, most likely they're going to probably crash, and then you need to stick them on that one capsule per day dose. I know something else I think we chatted about was the methylmalonic acid marker and homocysteine also being a lot better measures of the patient's cells assimilating the B12. I don't know if you could touch on that a little bit.
Well, methylmalonic acid is a is something that you would run if you ran an organics panel. So an organic acid test would show methylmalonic acid. And if that is showing really high, then you know B12 is not getting into the cells. So then you start looking, okay, why? If you're giving a person a B12 product now, the general thought is if you go with a sublingual product, you'll have a better absorption and you help to bypass the stomach intrinsic factor and any leaky gut issues. The problem is that doesn't always work. And their absorption through the buccal mucosa isn't always that great as well. So they still are end up swallowing the product. And if they have intrinsic factor issues, leaky gut issues, they're going to have poor absorption.
Yep.
Adding an enzyme helps the absorption piece. So that can be better. An enzyme can also be a carrier of B12 because there's other genes that you look for in the B12 pathway, whether the person can absorb B12. The TCN1 and 2 gene is the carrier gene. That's the transport factor of B12. And people with defects of that can't get it into the cell as well. That's what the enzyme can help do. And we see we do full genetic testing on everybody, as you know, Jason.
Yep.
And when you look at all the B12 factors in a person, it's gut issues. So if they have any gut issues, they're not going to be absorbing it very well. That's where the enzyme helps. There's a gene called the GIF gene, which is the gastric intrinsic factor gene, so that they're not even making as much gastric intrinsic factor as they should make. And then there's the TCN1 and 2 genes, and those are the transport genes for B12. So adding an enzyme to it helps it, helps promote cellular absorption of the B12, not just intestinal absorption of B12.
Yeah, absolutely. Just the more we learn about these genes and how dependent they are on enzymes, it just makes sense to combine some of these things with enzymes that are just going to help them, get to where they're designed to go. So just an exciting product to make, and definitely haven't seen a lot of B12 products out there with blends of enzymes and then having this more unique form that definitely has really good research on penetrating the cell and then putting that kickstart on it with the enzymes.
Right.
All right. Well, here it is, the the vitamin B12. It's the methylcobalamin form. So just for people that maybe are used to buying B12 off the shelf at Walgreens or Whole Foods or whatever, maybe you could talk a little bit about the difference between methylated form of B12 and like a non-methylated form. Yeah.
Well, there's really 4 different B12s on the market, and only 3 of those you should use. So one is acetylcobalamin, and that's a good form of B12, and that we use that a lot in our office. One is hydroxycobalamin, and we use that a lot in our office. And one is methylcobalamin, and we use that a lot in our office. So knowing which one to give the patient, you have to know more about genetics. Now, you can't really go wrong with any of those 3 B12s as far as injuring the patient, unless you go wrong on the dosage. So many times people will do a MTHFR test because they want to get deep in knowing what's going on with the patient, or the patient will come in and go, I have an MTHFR defect, so I need more methyl groups. And that is only partially true, because you got to look at a bigger picture of the gene. So if they have defects in their biopterin pathway, MTHFR, if you add methyl groups to someone with MTHFR defects, too many methyl groups, you'll push the biopterin pathway. And if they have defects in there, you're going to be messing with their serotonin and dopamine balances, and you could have some mood issues. So you could crash a person mood-wise really quick if you give too many methyl groups.
Yep.
That's why it's beneficial to have it tied to an enzyme. But that's where I started out this conversation is always start with low dosage. So only do one a day to begin with. Um, and go at least a month before you change that dosage. That would be my recommendation. The fourth type of B12 that I think you should stay away from is the cyanocobalamin.
Yep.
That's typically what a person's going to buy at Walmart or something like that.
Or it's fortified in their, microwave dinner or something.
Yeah, and you'll see it a lot in even some what you would think would be a better brand, and it's in their multiple. So,
Yep.
I mean, that's one of the hints. I always tell patients, how do I have to become a nutritionist to learn how to take a good vitamin? Well, there's some hints. How is the mineral chelated in the product? There's a big hint whether they care about it or not.
Right.
What form of B12 and what form of folate. So if it has in that vitamin, if it says folate as folic acid, then that's folic acid is synthetic.
Yep, it's synthetic.
So then they don't give a rip about.
Well, they put that in Wonder Bread, for goodness sake. Sorry, I don't want to get sued by them, but
it's like poison. I mean, that should be illegal to use folic acid. So you always look at that. That's my biggest key. If it says folic acid as natural folate or as methyl tetrahydrofolate or something like that, then they care.
Yep.
But if it says folic acid and nothing else, or folate as folic acid,
yep,
I tell people throw it away. It's not fit for man nor beast.
Yep. And like you said, it's amazing to see even you'll see it in even high end products. I mean, it's changing, thankfully, but I mean, it is still pretty common to find it in a quote unquote clinical based supplement.
It just kind of makes you mad, and you see it a lot with people that are, multi-level companies that maybe were formed off of a good product at one point in time, but then they decided to branch out and add vitamins and all this, and then they had just
well, why do we need a methylated B12? We can get this one for like 1/10 of the price. Let's just dump that in there.
Well, yeah, that's what the CEO of the company is like. We could save 30 cents a bottle by doing this.
Right. So anyway, topic for another day. So I think that probably gives a pretty good idea. It rounds out the product. It's simple yet powerful. I would just say we really think this is going to be a huge blessing to your patients. And just, if you can take anything away from this, just start them at one a day if you're not doing oats testing or anything else like that. To learn more about the product, you got the website up here. You can always email me, and then we both post all these videos on each other's YouTube channels. So here's Dr. Connors, and then here's ours for US Enzymes. Dr. C, anything else to add to close us out here?
Just encourage people to keep using good nutrition and keep learning. That's the biggest thing.
Amen. All right. Always a pleasure to have you, and looking forward to the next time we get together. All right. Good night, everyone.